Okay, so today I'm going to demonstrate how to insert a catheter, remove a catheter, and then also get a urine specimen from a catheter. So first I'm just going to go ahead and check my doctor's order. My patient is Joanne Jones. Dr. Jeff Milberg ordered her to get a catheter placed, a Foley catheter. So what we have here is I have a 14 French 5 milliliter catheter, and I have two of them just in case I were to break sterile field. I have an extra. I also have two sets of sterile gloves, and then I have a bath blanket, a chuck, everything I need for gathering my urine specimen, and that's all I need. So I would do my 7 rites with my patient. I would check to see if she had an allergy to latex or to iodine, and if she did, then I'd want to confront the doctor, get a different Foley, and then I would do my 3 checks as well. So outside of her door, I would check again, check my order, and then I could come to her room. So, knock knock, Joanne.
Hi.
Hi, my name's McKenna, and I'm going to be your student nurse, okay?
Okay.
Dr. Jeff ordered you to have a catheter. Did you know about that?
Oh, yes, ma'am.
Okay, so we're going to go ahead and do that for you, okay?
Okay.
So I would perform my hand hygiene, and then I'm just going to put on a pair of gloves. Joanne, can you confirm your name and date of birth for me?
Oh, yes, ma'am. Joanne Jones, 12/3/67.
Okay, I'm going to check your armband here. And then are you allergic to any latex or any iodine?
Oh, no, ma'am. I'm just allergic to penicillin.
Just penicillin. Okay, perfect. So I'm going to come over here. On a scale from 0 to 10, 0 being no pain and 10 being the worst pain you've ever felt, what would you rate your pain, Joanne?
Oh, 0 pain, Miss McKenna.
Okay. Just going to go ahead and move you up in bed here. Alright, so first I'm just going to move my other stuff out of the way. So I have an extra cath kit here. I would have checked the expiration on them as well to make sure they're not expired, and my sterile gloves as well, checking those. So first I'm just going to go ahead and put my bath blanket down. Alright, Joanne, we're just going to put this on to keep you a little bit more covered and a little bit warmer, okay?
Okay,
First, I'm going to pull your sheet down. Okay. Now, perfect. I'm gonna go ahead and put your chuck under you, okay, Joanne?
Okay.
So to get the catheter in, we kind of have to have you exposed here, and I'm gonna have to have you go into the frog position, okay? So we're gonna have you bend your knees. There you go, perfect. And then I'm just gonna get a chuck under you just to keep your sheets protected, okay?
Okay.
Now I'm just going to go ahead and cover you just a little bit just till I'm ready, okay? I would do any peri-care that I needed to do too if my patient needed that as well. And then I'm just going to go ahead and move my extra supplies here out of the way that I don't need. Okay, and then in these packages there is lubrication, but Joanne can't use that, so we have to use this. So I'm going to give it to Cassie because I can't touch that after I have my sterile gloves on. So then I would just remove these gloves, perform hand hygiene before touching my kit here. You'd want to check again, making sure, so I have a 14 French 5 milliliter catheter, checking the expiration. I'm going to use this as a guard at the end of the bed. Okay, move that out of the way. And I would make sure my hands are clean before touching anything. So if I needed to do hand hygiene again, I would do it before touching my kit here. And I'm just going to go ahead and open away, open the sides here, and then open this flap. Okay, so then these are my sterile gloves here, so I'm just going to go ahead and grab those out, set them to the side, and I'm just going to go ahead and grab my drape that I have. And I'm going to ask Cassie to just go ahead and uncover Joanne for me. You want to have the mat side up, and I'm just going to go ahead and set it down. And then I'm going to sterile glove. So I'm gonna go ahead and open up my sterile gloves. You can just stick your fingers right under here. You can touch the outer couple inches, you just cannot touch the inner. Okay, so I would start with my right hand first, and I would just grab here on my sterile gloves, kind of making an opening without touching the fingers of the gloves or anything. Set that on without touching your skin or anything else. And then with this hand, because it's sterile, you have to slide your finger under here without touching anything. You don't want to touch this hand with that sterile glove. So you would just slide this one in, pull that up, and then you can grab under here and make sure it's pulled all the way up, as long as you don't touch anything. And then you're sterile, so you don't want to touch anything else. You just slide that out of the way, and then everything in here is sterile, so you can touch it. You just don't want to touch the outer edge of your wrap here. So I'm just going to move this. So these are my swab sticks with iodine to clean, Joanne. So I'm just going to go ahead and open one of those. And then this is what the lubrication would look like, and you would dump it right into this here. And then when you uncovered this, you could stick the tip of your catheter into it and it would stick, but we cannot use that on Joanne. So I'm just going to set it to the side. And I'm just going to go ahead and uncover my catheter here. And this is sterile, so you don't want it to touch the outside of your sterile field. I don't need this till later. And then I'm going to go ahead and undo this, and I'm going to hook it to my catheter. And then when I checked my thing, I checked again to make sure I'm going to be inflating the balloon with 5 milliliters, not 10 milliliters. So that's something you want to double check as well. And then I can go ahead and set this here. And I'm just going to move everything right here. And I'm going to have Cassie uncover Joanne. Okay, Joanne. So first we're just going to go ahead and clean you, okay?
Okay.
So this is when you would use your sticks here. And you have 3 of them. So you start on the outside. So you would just go here and you would just go to the outside, making sure it's clean. Dump that into the garbage. And then you do the side closest to you, down into the garbage. And then you would do down the middle and toss that one. And then you're done with this. So I'm just gonna shake that. Okay, and now this hand is my sterile hand, this is my non-sterile hand, and typically I would already have lubrication on here. It would be in here and I would dip it, but I cannot do that with Joanne. So I would have Cassie spray this. You wouldn't want Cassie to cross your sterile field or for you to leave the sterile field. Okay. Okay, Joanne, so you're gonna bear down for me, and on the count of 3, we're gonna go ahead and do this, okay?
Okay.
So 1, 2, 3. You'll feel a little bit of resistance, and then you'll keep going. And then once you see urine flashing back into your tube here, then you would want to go for another inch or 2 in. And once you would do that, then you can go ahead and inflate your balloon. So we're only going to be putting 5 milliliters, so holding the tube here so it doesn't move. I would just insert my 5 milliliters. Okay. And then you can go ahead and remove that on the tube. And then you're no longer sterile because it's in Joanne and you're good to go. So I'm just going to go ahead and take these gloves off. I'm just going to put a different set on. Okay. And so you just want to make sure that you have a little bit of resistance, it's not coming out. And then your tubing here, you'd want to secure to Joanne's leg. So there's a couple different types you can use, but this would go here and you have a little bit of slack in her catheter so it doesn't pull on her or anything. And then this would just dangle on the end of the bed. You always want it lower than their bladder. You don't ever want to raise the bag above them. So it would dangle down here at the end of the bed. This would be secured to her. I would throw all of these away because I'm now done with them. And then now, if I were to need to grab a urine specimen, I'll show you how to do that. So I'm just going to let Joanne get comfortable here before I do that. And so what you can do, so this would be secured to her leg, so there's 2 different ways you can do it. So first way is you would take a needle and your 10 milliliter syringe, and you would clean your port here with an alcohol swab, and then you could put you'd uncap your needle obviously, put your needle in here, and you can draw up your urine out of here, alcohol swab it again when you're done, and then you can put it into a container however the lab needs it, and make sure it's labeled properly with Joanne's information, your initials, when you took or what time you took it, and all of that. So that's one way to do it, or the other way you can do it is with a cup. And because this is a new bag, you could do this. Now, if you had this bag for weeks, you could not do this, but you would unsnap the end here, open up your cup, flip your switch, and then you have to do it on the floor like this because you don't want to raise this above Joanne, so you would do it down below her. Empty what you needed into your cup, alcohol swab the end, and then you can put it right back in its spot here. And before I would have grabbed out of the port too, I would have clamped it with a Kelly clamp before I did that. And that's how you do that. And same way with this one, you want to label it with her information, your initials, the time you took it, and all of that. And then so now I'm just going to demonstrate for video purposes how to remove the catheter. But typically I would leave the room, I would clean up everything, I would document how much I put into her balloon, who assisted me, what time it was put in, how much output she had when I put the catheter in, all of that. But now just for the video's sake, we're just going to remove it, just for demonstration. So I would come into my room, I would do my hand hygiene, introduce myself, do my 7 rights, get her name, all of that, explain to Joanne what I'm doing. So I'm just gonna have Joanne go into the frog leg position again for removal. And then I would do my hand hygiene, I would put on a new set of gloves, and then I need my 10 ml syringe. I would check my documentation from when I inserted the catheter to see how much is in the balloon. So because I inserted it, I know that I have to take 5 out, not 10. So the first thing you're gonna do is just deflate your balloon. So the removal is not sterile, so you just deflate your balloon, making sure that there's nothing in there. Once you have your 5 milliliters, then you can take that, set it to the side, and then you're able to remove her catheter. So then you just tell Joanne, okay, Joanne, on the count of 3, we're gonna go ahead and remove your catheter, okay?
Okay.
1, 2, 3, and then you just remove it. And then everything would go here. And then you can just dispose of everything. The other thing you'd want to document too is how much urine she had before you removed it and after you removed it. I would change my gloves before touching Joanne. Then I can get her comfortable, cover her back up, sit her up in bed, and that is it. I would do hand hygiene as well, and that's it.